Good morning, Facebook family and YouTube subscribers. Today is Thursday, October 16th, 2014. This week we have some serious news out of Texas with two nurses who were treating a patient for the Ebola virus have contracted the Ebola virus themselves. So two nurses who were doing their jobs, treating a patient from Africa who flew into the United States and tested positive for Ebola. Now they have also tested positive for Ebola and they are being treated. One was flown into the Atlanta Emory Hospital last night. So after she caught a flight to Akron, Ohio, earlier this week. So today is Thursday. So she flew back from Akron on Monday on a Frontier Flight Airlines from Akron, Ohio to Dallas, Texas. She was up there in Ohio visiting family members, helping them to prepare for a wedding. The question that comes to my mind is she was a nurse in Dallas, Texas, helping this patient who died from Ebola. You would think that they would have quarantined everyone who was working around that patient who passed away, so they can keep track of to make sure that none of these nurses contracted the virus. But now we know that is not what happened. She flew to Ohio to take care of business pertaining to a wedding or whatever. She stayed with family members. She was on a plane. She was in public. She flew halfway across the country. On the way back, she noticed she was sick. She called the CDC. The CDC said it was okay because her temperature was not high enough that they felt that she would be able to spread the disease. And she got on a plane and flew back to Dallas, where she was immediately quarantined the next day or that day. I don't know. Well, now she's now being treated in Atlanta. This is kind of concerning to me because we've been told that the only way you can contract Ebola is through coming in contact with fluids or liquids from a person's body, skin contact. Well, somehow none of these women, these two nurses who should have been taking serious precautions, contracted the Ebola virus. Now, we know in Africa, close to 400 healthcare professionals have contracted Ebola, and more than half of them have died. So the nurse that they flew into the Atlanta area, they took her case very serious, and she may not survive Ebola. But she is here now in the Atlanta area at the hospital. I'm looking at Facebook and I see all these posts by people, and a lot of people are just not taking Ebola very serious, much like they didn't take HIV or AIDS very seriously. A lot of people think out of sight, out of mind, it has no effect on my life. I get a flu shot every year because I realize that the flu kills thousands of Americans every year. The flu can take you out of here. But I'm one of the very few people that I know of who gets a flu shot. The vast majority of my friends and family members refuse to get a flu shot because they think it has no effect on them until it's too late. Until they're in the hospital sick. I've lost quite a few friends who died from pneumonia. People who were healthy, in great shape, got pneumonia. Things got so bad, I think a lot of times they waited too late to go to the hospital and they end up dying from pneumonia. And had they got a flu shot, they probably would have lived. We don't take stuff very seriously until it's staring us in our face. Those nurses who were working on that patient in Dallas, Texas, obviously did not follow safety protocols, or they maybe just didn't know because there's still too much information. There's still too much investigation taking place, a huge investigation as to how these women ended up with the Ebola virus. And there's a question of whether there be more people who have come in contact with the Ebola virus. So this should be very interesting to see how this plays out over the next few weeks. I think we all need to be taking it very seriously. Although there's just a small percentage. I mean, you're talking about 2 to 5 people maybe here in the United States, but over in Africa, over 4,000 people have died in certain countries in Africa. Maybe more than that. They expect thousands more to contract Ebola and to pass away. So it could become a very serious epidemic. It could become a very serious epidemic here in America if it is not contained and controlled. Clearly, something is bizarrely wrong that a nurse who was treating a patient, this concerns me greatly, left a hospital, went on vacation, got on a plane, flew to Ohio, Akron, Ohio, hung out with family members and friends. No telling what she did in Ohio. And then flew back. And something's not right with this whole story. And it concerns me because it should concern everyone. Because what in the world, why was she on a plane in the first place? Knowing that she had, something's not adding up. Was she not told that she could not travel? Were they not put in quarantine? Well, obviously not. Were they not told that they needed to be watched more aggressively? Something's not right with this entire situation. But I guess over time we will tell what will happen as they continue to investigate. What I'm also hearing is that most of the nurse out of New Jersey, a nursing association out of New Jersey, has said these hospitals in America particularly are not ready to handle Ebola patients. And I think that's what happened in Texas. They were not ready. They were not prepared. They didn't know how to properly handle that Ebola patient without other people getting infected. And that's why we have these two nurses, possibly more people who will now become infected with Ebola because they just weren't prepared. They just were not prepared to handle a patient. That patient should have been quarantined and shipped to a hospital that was prepared to handle a patient with an very serious infectious disease like Ebola. But again, I'm not a medical professional. I'm just going by what I see on the news, what I've read on the internet, what I'm reading. I think we all should be concerned about it. I wouldn't take what's taking place with this situation very lightly. But I would be concerned and keep an eye on the news. I wouldn't panic like some people are just fearful, but I would keep an eye on what's taking place. You can kind of know what's going on. Seriously, because two nurses, that should never have happened in the United States, that these two nurses should have, knowing how serious this disease is and how to stop it, these nurses should not have been in a situation where they were able to contract the Ebola virus. But only time will tell how the situation will come when these women live, and will they be able to overcome the illness of this virus. Ebola is a very serious virus. It's one of the most deadly diseases on planet Earth. 75% of the people who contract Ebola die. That's a large percentage of people who there is no cure. There is no vaccination. There's nothing that can cure this disease, and we have to understand that. There's some stuff out there that they are trying, but they don't know if it's working or if it does work. They don't know. So I read when people say there's a cure. If there is a cure, no, there is not one that has been publicly put out for use to cure or treat Ebola. So there really is no treatment at all for Ebola at this time. Anyway, I'm going to conclude this video just telling people Ebola is a serious crisis, something that we need to keep an eye on. I would not ignore the situation if I were you. Like, I'm going to keep a close eye on the news, just kind of keep a wary eye and keep an eye out as to what's happening in regards to these two nurses who contracted the Ebola virus. If you like my videos, please click like, subscribe to my channel, and I'm out of here. Enjoy your Thursday. It's a beautiful day here in Atlanta, and I'm out. Have a great day.